Hi there, I'm Brian Waller, President of the Technology Association of Iowa. Now more than ever, Iowa companies are seeing themselves as technology companies. With me today is the Chief Information Officer of UnityPoint Health, Laura Smith. Laura, for those of people that don't know, what does UnityPoint Health do?
Yeah, UnityPoint Health is an integrated delivery network of healthcare professionals pretty much across the entire state of Iowa, but we also have presence in Wisconsin and Illinois. We have about 34,000 employees and serve a lot of patients and people across the Midwest.
During this time of COVID-19, how are you and your organization, you and your team, adapting and propelling UnityPoint Health at this time?
During this time, we're really relying heavily on digital and virtual technologies. We still think it's really important for people to get care, great care, and we've had to adapt and say sometimes that doesn't have to happen necessarily within the four walls of our organization, whether it's a clinic or a home care agency or even the hospital. And so one of the technologies that we have leaned on heavily and accelerated the deployment of is our telehealth and virtual solutions. So we're able to offer even more virtual urgent care or scheduled visits with the provider, whether that happens truly with a virtual face-to-face interaction or even a telephonic interaction, going a little lower tech there as well. But it really has changed how we're doing business and being able to show up for our patients in a different way.
So if we think about this time, what positive change or innovation has come out of this moment in time for your organization?
Yeah, I would maybe lean back a little bit again on these virtual interactions with our patients. That technology has been around for quite a period of time, but the adoption was slow. And actually, here's an example though where we had to accelerate the adoption for many reasons. And so I think a really positive change is that we have seen the adoption of those technologies both by our patients and even consumers and our providers in really short order. And so we use a little bit of an analogy where we did multiple years worth of adoption work in about 2 weeks in deploying these virtual care solutions.
Well, things have accelerated quickly. Before we let you go, what does the future look like at UnityPoint Health having gone through that? Can you look into a crystal ball?
I wish I had a crystal ball. I don't. But the one thing that I know is that because we have had some of these technologies or solutions be adopted so quickly, I think that though they're going to stick. And maybe not to the large degree that they are today, but I do think having these different virtual options available to our patients and consumers will always be part of our landscape, and I do think to a larger degree than they have in the past.
Well, Laura Smith, Chief Information Officer of UnityPoint Health and also our 2020 Board Chair, thanks for all you're doing for our community, for the technology industry. Have a wonderful day and thanks for joining us.
Absolutely. Thank you, Brian.